snakebite poisoning, 2009. International Society on Toxicology, 2008. I have some books, Harrison's, Davidson's, pictures from Nat Geo and other wildlife sites. Thank you, sir. This is a fake photograph. This is a fake photograph. Actually, internet's loaded with this type of photographs.
Now, suppose you give antihistamine, suppose it's an anxious patient and you suspected snake bite and gave 5 vials, no problem, no any damage?
No problem is there. No problem is there. Availability antipsychotic. How many vials you think we do have in our casualty? So availability is very difficult in Indian society.
Good morning, sir. Very good, thorough elaboration by Dr. Paul is given. Just some questions continuously. Dr. Samantha is asking to Dr. Paul how much. Basically, this last week, Dr. Paul tell us that he will present on snake bite, and we have gone through regarding the protocol. Dr. Ian Simpson, who was making this do it right. Just we met him, he came to Calcutta last 3 years before in our organization. He was here for 4 to 5 days, we interacted them. He had made some protocol, and 4 state government, West Bengal, Rajasthan, Tamil Nadu and this, they have followed the Ian Simpson, a herpetologist, world famous herpetologist. And we have interacted with 3 days under him. He went to Sundarban, he went to Midnapur, he went to all, because snake is a local problem. Treating snake bite is a absolutely local situations, and doctors should be acquainted with that. Basic snake bite, like I will take 5 minutes in summary. What to do and what to not do. That do it right. Right was the reassurance, because 90 among 100, 70% are non-poisonous and 30% poisonous. Among 30% poisonous, 50% are non-envenom dose, so they are not away, and 50% are having an envenom dose. So first of all, don't get panic, because non-poisonous are will be not causing envenomation, and only symptom is the autonomic nervous system disturbance. So mostly patient will present with thumping feet, panic, frightening. So that's why first treatment is do it right, means R for reassurance. So reassurance itself will half because even doctors get panic. When we saw one snake bite is coming, our heartbeat will also start. What happens? We'll do this. And there are 4, 5, 7, 10 members will have an ANS disturbance, autonomic nervous system disturbance. So we should immediately judge, tell them, hey, you don't worry, we are here, we will see you and we are watching you, please be sit here. 90% of the panic will come down. Number 2 is the immobilization. What old and new. Immobilization is just like immobilization by the like of fracture management. So Dr. Simpson has stressed us, given demos, they have trained us to all that. What earlier it was a ligature system, मिल गया रस्सी से बांध दिए, ligature से बांध दिए, tight बांध दिए. It was an absolutely wrong step, because our only target is to prevent the lymphatic split. So don't put a ligature, just like a space fracture we are giving this, just wrap one by one slowly, so that it should not compress the things. I'll make it immobilized, because 3 to 4 minutes of walking will lead to more spread of it. That is one theory. Third is the after immobilization, RIGH. GH means go hospital, rush to hospital. Earlier it is in the village area, it is the Oja, it is the snake doctors are in village. So but nowadays I think most of the even educated low socioeconomic are coming to hospital. They are coming to MBBS doctor. So it is not a problem. Now your question is that how to check it and what, as a doctor what to do. So here the clear cut is that you have to tell the sign. means D means doctor, the patient or patient party should correctly tell the sign. And as a doctor, actually 3 symptoms we have to watch it. Number 1, is it a local swelling? If local swelling, half of the fangs might, because the half, if the area is swelled, it is a sign of invention. If there is a neurological symptom too, and most common laboratory test is the 20 minutes W test. So these are the 3 criteria of which doctor should decide we have to inject AVS or not. So now the things regarding the correct method for doing 20-minute test. We have to keep a very nice, clean, dry test tube. Because if it will be undry, unhealthy looking test tube, you may get confused that it is a clotting or not. So it is a clear-cut guidelines that it should be absolutely clear, crystal clear test tube. So that should be kept 20 minutes watch whether coagulation, no coagulation. So that is the one test, and followed by these 2 that delta times and this. Third is that suppose we are starting, now we have decided we want to give ABS, how much and when. It now depends on symptom, because throughout the world only 3 is criteria. One is the hemotoxic, neurotoxic and myotoxin. In India myotoxin is less, but in our zone, Midnapur, Kharagpur and this area is having Chandrabora, is a very vital, basically it is a variety of viper, and it is a small snakes found in this area. And in our hospital also we have received 5 to 6 cases of Chandrabora with complication referred from this. Last 10 years we have not lost even a single, as I remember 12 years when a single bite, more than 25-30 bites we have received. But here the things is that how much we have to start. The things is.
I received one patient as casualty referred from Kharagpur after 3 days of snake bite.
Yeah.
He was having no local and systemic signs of it. He was having only compartment syndrome.
Yeah, look, last year, Alappa Swamis and we have received with fully compartment syndrome with this. Now the thing is that, sir, we have to give number 1, 10 vials. So what Ian Simpson has given the criteria that we have to give it up to initial dose of 5 to 10. He was telling me you have to hit with the full dose. And in Viper, your question was that how much Viper? He has given that in Viper bite maximum 30 vials, and in Elephant's bite means Cobra and this 20 vials. So this now we are following the guidelines, but should be individualization of the case. I have experience of in medical college, Dhananjay Medical College, we have treated more than 300 snake bites because that is a flood zone, and every emergency we are receiving 4 to 5 snakes bite. So we have a huge experience. So where we are using 35 vials of ABS in Cobra, and current was very common, and in flood zone current are coming to outside.
I excluded one slide from there, that was from PA Chandigarh, the study. The low dose snake venom is as effective as high dose snake venom.
So 20 and 30.
Study.
So 20 and 30 vials is the standard. And only thing is that we have to reach, and so many complications that will be treated. But only by simple things, yes, Ian Simpson after 9 and 10, they have seen that 20,000 vial ABS has been saved. In Midnapur Medical College, my friend Dr. Sumitra was a professor there. He was the nodal officer for this project, and he has shown before this protocol and after this protocol. Because a doctor may also get panic. Give it, push it. No, we have to follow the clear-cut guidelines, and this is the ideal way for the treating. We'll make it a protocol with this and hand over to CMD sir to circulate this protocol, because West Bengal government have already accepted this protocol. And to all our, particularly Adra, CKP and this zone, villager zone with the snake bite. Luckily in our hospital we are getting less number of bites, but sometimes with complication, with renal failure, for that secondary referral we are getting this. Thank you.
Whether 2010 WHO strongly recommended this notification of this disease under T063 column, but we are not following it. Strongly recommended.
something is test dose should never be done now. One message is that test dose, ARV test dose, it is absolutely now banned. Early days we used to give this, now that has been banned now. They are saying don't do the test dose. You select the symptom and give it the ARV. So that is the and if it is treated properly, so many cases.
API.